a rotation in colorectal surgery is when I knew really that colorectal surgery was my chosen career path. What I found during this time, however, was with colorectal surgery, as you're aware, there are a number of various conditions that are associated with it. But what I found in particular with inflammatory bowel disease, and in particular Crohn's disease, some of the decision making, not the fault of the doctor or the surgeon or anybody, but Crohn's disease being so difficult to manage, we found often that a lot of the decision making was at times not clear cut. It's difficult to make the right decision, particularly in the setting of surgery. So that somewhat led me to want to do research into providing the best sort of quality of care.
And that's so your research at the moment, you're looking into Crohn's disease in particular?
That's right. Yeah? So it's quite common for doctors, if they're pursuing a particular specialty, to take a period of research out. And what I'm doing is an MD. I'm registered with Imperial College London. And in particular, I'm looking at patients with Crohn's disease, and we have a database that's set up. Just a bit of background on Crohn's. It's essentially a disease that can affect any part of the gut, from mouth to anus, but the most commonly affected area is a bit of the small bowel. And till this day, we still don't know which is the best form of treatment, whether it's putting medication after medication after medication, steroids, infliximab, and all sorts of medications to help dampen the immune system. Or do we perform surgery? Do we remove that portion, join the ends together? And we still don't know what the right answer is. So a lot of my studies are trying to find out what is the best way forward in terms of managing patients with Crohn's disease.
And I suppose patients with Crohn's disease as well. Obviously this is an ongoing thing with many patients. I have a friend who has Crohn's disease, and he has good and bad days as well. And I think people sort of don't quite realise that it's not so much you have to live with it. Whereas with the cancer, sometimes in the early stages you can find it, grab it, take it away. But Crohn's is ongoing, isn't it? So I suppose there's more. There's got to be a little bit more research in some ways to see how you manage it.
Indeed, I mean, when somebody comes to me and says I have Crohn's, I can't feel anything but sympathy for this horrendous condition. It's absolutely horrendous. It really does have a huge impact on young people, on their quality of life. It really does affect, people's lives and the lives of their close relatives as well. So the real goal of therapy isn't to so much cure the disease. There is no cure, but really to manage the quality of life, to ensure patients have a good quality of life.
And how long is your MD for? How long are you doing the research for?
So I am. It's a 2-year MD. It's actually due to finish at the end of July.
So you're under pressure then?
Yeah, there is a lot of pressure at the moment. That's right. But no, I mean, my time at St. Mark's has been absolutely fantastic. St. Mark's really is a fantastic institution. There's so much to learn from a lot of experienced people.
Yeah, exactly. Yeah. Listen, thank you very much.
Today, it's the 4th of April today. Please stop and have a look. We're here from St. Mark's, and we're here to tell you all about bowels. So we have many stalls. We have the St. Mark's Foundation at the end. But very exciting here, we've got the bowel that you can walk through, and I'd love to be your tour guide. So what do you know about St. Mark's, ladies and gentlemen? We're the largest international referral centre, and we're very, very honoured and happy to be based at Harrow. We want you to come through and come and talk to us, ask us any questions you wish, and we can talk to you about our research. We do lots of research at St. Mark's, investigating bowel problems, all the way from the mouth to the rear end. So do stop by and ask us questions. I'm just going to talk to my colleague here.
Right, good afternoon, everyone.
Good afternoon.
Now, it tells me here that you're in the research department.
I certainly am.
What happens there?
So the research department at St Mark's, we have 22, at the moment, 22 research fellows. So we might actually just go back a bit and say, what does research mean? So if I want to buy a pair of shoes or a car, I'm going to walk around and I'm going to look for the prices, I'm going to look for the type of shoes that I want, and then by the end of my tour of this shopping centre, I'll know exactly what shoe that I want, how much it costs, and then I'll go for it and I'll buy. I'm not going to pick the first one that I see. Same thing with research. We've got a question that needs answering. Why is it that wounds don't heal? Why is it that I've spotted blood on the toilet paper? And for that question, there are answers, but they're not right here in front of us now. So we're going to investigate why these things are happening. That's what research means.
And obviously you're looking at different research into cancers as well as Crohn's and as well as other sort of bowel diseases as well? Or is it focused on one particular?
Absolutely. So the 22 fellows that I mentioned here at St Mark's, each one of them has got a specific research area that they're looking into. So we're looking at genetic problems. So why do people get certain polyps and not others? So we've got that type of research. I'm looking into fistulas. So I'm looking at why they actually exist and why we can't get them to heal. So the research can be from a laboratory base, people looking at microscopes and looking at things there, clinical, working with patients, going to radiology, or actually going into the endoscopy side. So we've got various projects. So some of them will be into inflammatory bowel diseases, some of them we will be into cancer, some of them we will be into pelvic floor. So all the various conditions that affect the bowel, we're certainly looking into all of them. And each one of the research departments is answering some of these questions that haven't been answered by the international community.
Is that going through blood tests as well? Because I've got a bit of experience of when I went to St Mark's, and this gentleman took my blood, and he asked me, he was doing research upstairs, and he was very excited about my blood because I myself had cancer, and he had it, and he had 30 minutes to look at this stuff.
Yeah.
And he was looking at a vaccine for like people that are predisposed to cancers, particularly breast cancers and stuff like that, but anyone that's predisposed. I never saw him again. He ran away and he went up to his laboratory. Hopefully my blood helped, but I guess that's one of the research things as well.
So the research looks at blood, it looks at samples from biopsy. So my colleague who ran away with your blood, I know him very well. He's always running away with blood. So what he would have done is go up there and try and get all the cells from that blood and see their functionality and compare those cells to somebody else who doesn't or has never had cancer before. And these are the, these are the questions that we've got, and we need to understand the difference between somebody who's had cancer before, somebody who's got cancer now, and somebody who's never had cancer, and see if we can prevent the process from actually happening at an earlier stage. So the involvement of people in research doesn't have to mean that you've actually got the condition. We also welcome people who haven't got any bowel conditions at all, because we always need to compare with normal. And also we've got the research and development department at Norfolk Park. They work very closely with St Mark's, and we engage the public in the research projects that we're doing. We've got a patient panel, and we talk to them about all the projects that we're doing, and we ask them whether they think it's a good enough project, whether we should ask further questions. We also do qualitative research. It's not all about labs and blood. So your quality of life today, how are we going to assess that? There are certain ways of doing that, and we're certainly looking into it.
I'm all right at the moment, not too bad.
That's
So that's quite good. Really.
It's a good day.
Obviously, this research it needs funding. So how does that go about? And is there anything people can do?
That's a very good question. I mean, people say money talks, don't they? Now, certainly we've got the help of the amazing people at the St Mark's Hospital Foundation. This is a charity, and we do have a stand right at the end there, so we'd be very grateful if you could visit that stand. And St Mark's Hospital Foundation raises funds for certain projects. So if I had a project today that I thought it's a question that's never been answered before, and it's a very important question because it affects patients, affects their quality of life, and it's a condition that's very important that needs looking into, I would approach St. Mark's Hospital Foundation and say, please help me find the funding to go ahead and have a research fellow who has a salary, who works solely on this project, and get all the lab stuff, all the equipment. Everything costs money, but at the end of the day, we try, with the help of the foundation, to raise those funds in order to be able to undertake the project and answer those questions. So the foundation is very important. It's an integral part of St. Mark's. And we also rely on the public. Donations are very important to us as well, and we'd be very grateful if you can, again, support the research at St. Mark's and all the projects that we do.
And also, in terms of research, things have moved on in the last few years, the acceleration in research. So where does that brought us, sort of where we are now in finding cures or finding things, a way of slowing diseases down and everything else?
So St. Mark's is at the frontiers of the bowel conditions, and we do hold a conference once a year called St. Mark's Frontiers. So it answers most of the questions that you've got with regards to bowel conditions, and specialists from all over the world, not just from the UK, will attend this conference and see what's new in research and the therapeutics that we're doing here at St. Mark's. So the research will always lead to something hopefully translated to clinical, so we can actually treat certain conditions. So when we look at the genetics and the polyposes, we've found some new genes quite recently that can shed light as to why certain people get polyps in their colon and not others. We've found some findings as well with regards to the bottom end and fistulas, and we've found some new molecules that have never been found before. And if we can target those therapies, we can find a specific drug that can block certain molecules. Perhaps we can find the cure. But it's not just about finding the cure, because some of the conditions we can't cure. But if we can actually make the quality of life of people better, and we can make, if we take away a cancer and we make sure that it doesn't come back, then that's also an achievement and a half.
Well, listen, thank you very much. It's been brilliant. Give a round of applause, please, ladies and gentlemen.
Please come through and ask questions, and come and walk through the bowel.
Yes, come and